Welcome to Heart-Based Medicine's Heart of Healthcare podcast, featuring Dr. Gregory Kelly, ND, Naturopathic physician product formulator at Neurohacker Collective.
And today I have a really special guest with us here. I'm really grateful and pleased and honored that Dr. Greg Kelly is with us today. Hi, Greg.
Hi, well, thanks for having me.
It's a really great pleasure to have you here because you are a naturopathic physician, a naturopathic doctor, and you are the lead product formulator at Neurohacker Collective, and you are the author of the book Shape Shift. Maybe we'll find time to come back to that in a bit. So you have done multiple things. You have this amazing career where you have been, editor of the Journal of Alternative Medicine Review, and you've been instructor at the University of Bridgeport in the College of Neuropathic Medicine, where you have taught advanced clinical nutrition and counseling skills and doctor-patient relationships. So one of the reasons why we came into conversation, not only as Neurohacker was partnering at the summit, the Heart-Based Medicine Summit last year, where we saw us in San Francisco, but specifically around kind of doctor-patient relationships. And you have a really, really interesting story to tell, because you have not only, you kind of have both parts in you. You have this really scientific mind in you because you've published, papers. That's like, I think, 30 plus papers in PubMed, and you are specializing in this very scientific product of the development of Nootropics with Neurohacker. And so this is a highly scientific process. And at the same time, you are really conscious of the importance of everything that is around kind of the pills and what we've learned in terms of knowledge and scientific approach in medical school. So I'm really pleased you're with us. And I wanted to start our conversation with a very unique part of your biography, because you told me that you actually went to the Navy. And I thought this was such an interesting element that we can actually learn a lot from as physicians. And I wonder if you could just briefly outline what your experience was at the Navy.
Sure. So the Navy is definitely an odd background for a naturopathic doctor here in the US. I know when I went to naturopathic school in the early to mid 90s, I think literally I was the only one that had been an ex-Navy officer. There was one of my classmates had been an ex-Air Force officer, and then there was a few people that at that point had way back in the Vietnam era been enlisted. But the Navy is, for whatever reason, like if you had asked me when I was 12 years old what I wanted to be when I grew up, I would have said, I want to go in the Navy. So it was super concrete from a young age. And so what ended up happening at the tail end of my high school time period, I applied for a Navy scholarship, was awarded it, and so they paid for my it was an engineering degree at the time. And when I graduated, the deal was you owed them 4 years of active duty and then 2 years of reserves, and you would go in as an officer. So I graduated in '84 from an engineering school in Massachusetts, and then came right to Coronado, which is in the San Diego area. It's one of the big, they call it an amphibious base for what would be the equivalent of like the officer's basic training. So it was about a 6-month school, and then was deployed onto a ship for the next, what ended up being just over 4.5 years. And so,
where did you go on the ship for 4.5 years?
So I was on 2 different ships. The first one was in Hawaii, stationed at Pearl Harbor. And then the latter one was a slightly larger ship, and it was in San Diego, which was where I started and ended my US Navy time. We're in the San Diego County area. And one of the things you and I talked about, a little bit before going live, was how the Navy, at least in that time period, so this was the Reagan years here in the US, has a lot of parallels to the medical system, and time being one of the key things. So, what I experienced in the Navy was that really you didn't have time to do your job well at that point, because you had, essentially more work than there were hours in the day to do. And then if you were out at sea, layer on top of that you had to stand watch quite a bit. So my my first job in the Navy, I was in the engineering department based on my academic background, and there was only 2 of us that could stand watch. So the way that translated is when our propulsion system was lit off. So we were a steam-driven ship. So that when the boilers were active, there was only 2 of us that could stand that particular watch. And so we called it port and starboard. But what that meant is you were on watch for 6 hours, off for 6, on for 6, cycle.
Tremendous pressure. Huh? Yeah.
Right. And then in addition to that 12 hours a day of watch, you still had to do your job, and sleep and eat and ideally get some exercise and do all these other things. So time ended up being this incredibly limited resource that you just didn't have enough of to feel like you could do your job well. And then what happened, it used to be the saying back in the 80s that the Navy ate their young. And what the implication was, if you were a high performer, in addition to your job, they would give you other accessory jobs to handle because they felt like, well, we can trust you to do it. And if you did that well, then they would give you more. So I think, I know I had 4 additional jobs, at some point as well. I was in charge of the weight loss program for the ship and the fitness program and the, they called it the lock and key program, but all the secure keys, inventorying those. And, it just went on and on. And so, it was just this fascinating thing that no one seemed to, everyone acknowledged, but no one had any solution other than, well, if you're effective, we'll just give you even more to do because someone has to be assigned this work.
Amazing. Yeah. So this, I guess every resident, every fellow will be able to associate with what you're saying. And you probably had a kind of replay of this during your naturopathic training when you were in residency. It kind of felt similar.
Naturopathic training was a breeze in comparison.
Okay, so stop complaining, guys. Okay. Yeah, well, interesting, because here's a team. You're working in a team in a really contained area. You're kind of overburdened. Time is really a very valuable commodity, and you're running at the edge of your capability. And you know that if you're not performing well, it's not just that you don't perform well, but the entire team will suffer. And that is something that we very well know from healthcare as well. So how did you deal with the fear and the uncertainty that you had to face every day?
Well, I think there was a few things that the Navy does well that there might again be some parallels, but one, you never had to, a lot of the daily decisions that people have to make are already made for you in the military. Or again, this goes back to the 80s. I can really only speak to, my time in, but what to wear, what your hair should look like, when you're going to eat, what you're going to eat. All those things have been pre-decided for you by virtue of being in this system. And one of the things I remember a director of a lab here in the US back in the late 90s talking about what he'd seen in natural killer cell activity testing. And at the time, what had surprised him, or what he communicated to me and this other doc when we were speaking with him, was that a population that had tested out with better activity than he would have imagined were people in the military. And my guess was that despite all the stressors, these low-level things were taken off the menu. Some degree of decision fatigue was eliminated by virtue of that. So that was a positive. You just didn't have to sweat any of those things. And then in terms of dealing with it, I think for me personally, that's where I first, focused on healthy eating. Was, pre that, I had just eaten whatever someone put in front of me, literally. And then, I was fortunate early on. One of the people I was in training with was into exercise and lifting weights, so he taught me the basics there. Yeah. I think for my very first Christmas in the Navy, my parents sent me a jump rope, and I literally carried that jump rope for 20 years everywhere I went. So that, I started a jump roping habit way back then. And then for me, there was some other things I did that weren't particularly useful, but they were coping mechanisms. And I think in that time period in the US Navy, drinking was a pretty big issue that, I think it's been definitely dealt with much more substantially since then. But it was an interesting time period in that mid 80s because it was still close enough to Vietnam. I think of maybe as more of a Wild West time period, with then the Navy trying to modernize and integrate women into the service and other things. So even while I was in, drinking went from somewhat of an old boys, like acceptable, to, big trouble if you cross certain lines.
Yeah. Yeah. So, I mean, this is very understandable. Under high pressure, we know this in the healthcare system as well, right? So we know that there's drug abuse, we know that there's alcohol abuse, we know that there's all sorts of behavior that is, living off the vending machine and coffee, rushing down coffee like crazy. And so we know that kind of unhealthy behavior or even addictive behavior is something common in the healthcare system as well. So I was wondering, because what both systems in a way have in common, while being quite different, but something they have in common is that both tend to be quite hierarchical. And as a regular, foot soldier, if you like, you have very limited insight into. So some of the things are convenient here because decisions are taken off you, as you said. But the other bit is that you're actually exposed to uncertainty and you don't have really full insight. So you kind of need to trust this hierarchical system while being at your edge. And do you feel that this is kind of a concoction where they feel like addictive behavior or the non-healthy behavior starts unless you really make it a conscious choice to not go into this?
I think I would agree. When we don't understand the why behind things, it's tougher to buy in. And then, at least my experience in the Navy, you'd get, so any new program that got put in place, say it was a new safety program, there would certainly be, a why you could agree to, like, this is important. But with no resources to do it, no new time added in, it just became frustrating that, all right, like, I get this is important, but, you can't squeeze blood from a stone kind of thing.
Yeah.
And that same type of frustration is something I've seen with doctors and health professionals in the US, where there's just essentially someone outside of their practice, maybe it's an insurance company or maybe it's their board, comes up with this good idea and says, okay, we're going to now do this, but without considering that, that what's that going to mean to the person that's implementing it? Did we give them more time? Like, sometimes it sounds like we will, but rarely does that end up happening.
The case. Yeah. So what happens? So you're coming from this high pressure environment with it's kind of hierarchical, and you're dealing with pressures, and you find kind of more or less healthy ways in some departments, more healthy in other areas, less healthy ways to deal with this. And then somehow a shift happened when you decided to actually become a naturopathic doctor.
Yeah. So what ended up happening, there was probably about a year and a half before I got out of the Navy, I had at that point decided that I was going to definitely get out. And I was already doing a few, healthy things, but my plan when I got out, for lack of a better way to describe it, was that I was just going to get rid of everything and just travel. I would have said I'm going to be a gypsy if you'd asked me. Literally, I think that was the word for it. And it occurred to me that to do that well, I needed to be able to take better care of myself. And so my last definitely year in the Navy, most of my free time was focused on what we would now think of as alternative medicine, like learning a little bit about acupuncture, a little bit about herbs, a little bit about, I started to do yoga and became a vegetarian at that point. And, so for me, it was interesting in that last year, having transitioned from much more like the heavy drinking, much more normative, surface line officer, to someone that was starting to, get into meditation and yoga and, a lot of things that, frankly, in 1988 were not particularly, well known even outside of the Navy. And so when I got out of the Navy, my goal really, or my main interest, was, what does health look like? Like I had learned enough to know that, all right, there was this, let's just call it disease management. There was this, super cool system that I, superficially interacted with, because my ship would have had a corpsman, so like a the equivalent of kind of a nurse. Some of the bigger ships the bigger ship I was on had a doctor. And, so I had a lot of confidence in them and their ability to take care of the problems that came up on the ship. But my overall understanding of medicine was fairly naive. So if you'd asked me somewhere in that time period, what does a medication do? I would have just said something like, well, you just take the pill and it goes in and fixes whatever would be, broken, right?
Fair enough.
Or kills whatever needs to be killed. So I didn't have much of a, I didn't have any in-depth understanding of how medications work or really what the medical profession did. And then in my, search for taking care of myself, I just stumbled on, wow, there's entire other ways of thinking about health that, that are worth exploring. And ultimately that led me to the naturopathic doctor road.
So you were out to understand the science of healing, of health, and you also looked at kind of the science of shifting.
Yeah. So for me, in that transition from kind of a normative Navy officer, I was not ever normative because I was one of the few that exercised and ate well, but to someone that was a little bit, like more extreme, what had happened for me is my dad, super busy executive, but during that time period, I essentially created a really loving relationship with my dad that hadn't existed before. There was other things like that had created what I would think of as a shift inside me. So things like becoming a vegetarian, getting into yoga were just now almost a natural part of the new me, where drinking, on the weekends was more a part of the old me. So that shift in essentially my identity is how I tend to think of it, happened somewhat spontaneously for me. I think of it, a bit like the story of, Saul on the road becoming, graced by spirit and changing his path. And so for me, that same thing happened. And one of the reasons I went into naturopathic medicine, it seemed like they at least had a little of interest in that shift where, at least in my looking into it, the more traditional MD or DO path, not so much here in the States at that point. Mm-hmm. And I would have said one of my keen interests would have been that, what you're calling heart-based medicine, but that mind body, that what's that part of us that can create magic if we tap into it and shift some orientation to a relationship with other people, to ourselves, or to the things we're doing.
Yeah. So when this became clear to you, when this became really the center of your attention, that was also the time when you started to appreciate health as a system phenomenon. So health is sort of, you knew how to eat well. You knew that you can actually, that there's more to the pill goes in and fixes something. So kind of the individual and personal health became clear. But then you realized very soon that actually health is a kind of a system phenomenon. And you've seen some aspect of this during the military. And then as a naturopathic doctor and really looking at your own environment, you had a possibility to kind of really expand that view and start kind of building on this view of complex system health regulation. Can you expand a little bit on this? What happened?
Yeah, I think in a big picture, let's talk about the bigger system. So the Navy. So since I ate well and exercised, I was the natural fit to be put in charge as one of my accessory jobs, in charge of both the weight loss program and then what was somewhat of its sister program, which was the Navy had a physical fitness standard, still does, but it wasn't particularly hard. You had to, I think it was run 1.5 miles in a certain amount of time, do a certain amount of push-ups, sit-ups, pretty basic stuff, like what you'd kind of imagine for a military physical fitness test. And my recollection is we administered that twice a year. There'd always be a subset of people that didn't make one or more of the standards that then you'd have to work with to pass. And I think if they failed 3 in a row, then that was grounds for discharge. So there was a lot of motivation. But so what would happen is the person in charge of getting these, people that were fairly sedentary so that they could pass these physical requirements, I would get tasked with exercising them, but without being given the time from the system, like from the ship in this point, to like make that happen. And what ended up happening, a lot of the people that struggled to meet these physical standards were actually among the best performing sailors at their jobs, because they didn't exercise, in part because they were really dedicated to work, right? They were workaholic personalities. And so the weight standard was somewhat similar. The Navy menus back when I was in were largely the same as what was put in place in World War II. And what I was told by the person that ran the mess hall, is what we would call it, that the studies that were done decided during battle type pressures like World War II, a sailor would need to eat 4,000 or so calories a day. So the menus were all designed to achieve that. So they would want people to lose weight in a setting that was essentially feeding lots of food, most of it of relatively poor quality, where people were sleep deprived, doing, rotating shifts, so body clock dysfunction, and, largely sedentary because your exercise options out at sea were very limited. And so the system wanted one outcome, like, in shape sailors, but everything the system had created was working against that. So what would classically happen is a new sailor arriving on a ship from boot camp would be in great shape, but a year later, not so good, right? So that's like what I've done some work in corporate wellness too, and the same thing, like the head of HR will want one outcome, but without changing the corporate system, the environment to better achieve that. So that's one system. But then I think us as humans are complex systems as well.
Yeah.
And so, what that idea of or the driving question, what does health look like? In my efforts to answer that, I just kept stumbling on things that, let's take body temperature as an example. My early, like my naturopathic time period, if you had a low morning body temperature, I think 97.5 or below, they would want to diagnose you with hypothyroid, like the Broda Barnes approach, and put you on glandular thyroid. And so my first morning temperature was below that. And here I was, I biked in and out of work. I did all these healthy things. I'm like, this doesn't make any sense to me. So I started looking into temperature, and I ultimately wrote a 2-part article on PubMed on it. But like a healthy body temperature should be less than that in the morning, but then should be much higher in the evening because it's got a really robust circadian rhythm. That's one area of complexity, is these biological rhythms. And then heart rate variability, when you see that type of, what I think of as a stock market signature, that's a signature of a nonlinear system, hence complex adaptive system. So in looking at what does health look like, it became impossible not to see that health looks like a complex adaptive system. Yeah. And that something even as simple as body temperature, it matters when you measured it before you can even attempt to get any meaning from it.
Yeah. This is so interesting. There's a whole wealth of points you're making here. So one, I was just thinking, I worked in a lot of hospitals, and I was wondering whether there was ever kind of a health standard taken even in a lifetime. So it's interesting. So cab drivers, need to show that they don't work more than 8 hours. Soldiers are being tested for fitness standards and health standards. At least, that's the attempt, for all the system failure that might go with it, or the kind of shortcomings of the system that might also be there. But at least there's an attempt. I haven't seen any hospital or any place where doctors would actually be held to a certain, nutrition standard or health standard or behavioral standard. Or it's interesting. It seems like healthcare professionals just know these things well.
Well, one of the things, again, like the Navy did some really great things. So one of the things, hearing on a ship was super important because you're around a lot of sources of things that could damage your hearing. So the Navy, even in the mid-'80s, had really advanced hearing standards to monitor that and make sure that, as much as possible, people were protected. So a lot of what the Navy did was designed for safety and to, I think somewhat selfishly, like they knew if people stayed in and retired, they were going to be paying, a pension to these people for the rest of their lives. So, they wanted healthy sailors, both in the Navy, but as they left the Navy, it was also important. So, the Navy, I think in a lot of ways, even in the 80s, was further along than we tend to be today.
Yeah. Yeah. And you emphasize, so one is kind of the system health attempts and shortcomings. And I guess we see this in our hospitals, in our healthcare system, as well as we probably still see it in other systems such as the military. So it seems to be an ongoing challenge that would merit to be addressed. You also mentioned the individual, so kind of the wonder, the miracle of how complex the system is and how to regulate the complex and systems such as our body. And your life brought you to work with Neurohacker. And one of the key elements of what I feel is really intriguing and interesting about Neurohacker's approach is that this is not so much one small molecule that kind of changes one receptor switch to do something different, but you're actually kind of really taking a complex system approach. So tell us a little bit about what got you into Neurohacker and how you became the kind of lead product developer.
So really the main thing that attracted me to Neurohacker Collective was Daniel Smockenberger. And, listening to him on some, podcast, but then speaking to him, like after it was funny, I think when I put my resume in, say like noon on a Wednesday, and around 9 that night, I got a text from Daniel, right? He just showed up, like, hey, I'm, Daniel from Neurohacker, can we talk? I'm like, sure, whatever. And he's like, great, I'll call you in 10 minutes. And by the time we hung up that night, I was like, wow, he's like, I really want to work with this person. So, I'd been fluent in the dietary supplement industry, I would say. I'd been a student rep in 95, 96 for one of the big professional companies in the US, and then worked for them full-time for a year and then part-time while I was in practice, and, taught clinical nutrition to naturopaths. And Daniel was the first one that started to talk about how important it was to approach supplementation from a complex systems approach. Yeah. And so like he had me like literally on that call. And, and I think complex systems is not how we tend to think of things. So like there's a few principles I feel like are really important, just whether we want to become experts in complex system science or not. I think it behooves us all to understand a few basic principles about how these systems behave, because ultimately, whether you say complexity science or quantum physics or any of these models of science, their goal is to predict how things will behave. And one of the core things of complex adaptive systems is that adaptive. So this idea that things are going to learn and literally change the rules as the game is played. And so that's super cool. That allowed, like, that ability for my system to do that when I was in the Navy, let me survive in a system, and job that was frankly, like, tough, sleep deprivation, body clock stress, time periods where we had hostile ships with their missiles locked on us. And, you could kind of go on. And that ability to adapt is, what allows us to survive and thrive in time periods. But, I think even something like adaptation is, like poorly understood. So my base case is that the human mind body is going to try to adapt to literally everything. Mm-hmm. So what that means to me is that if I was to see a study on supplementation and a good thing happened after 5 days and it happened after 1 month, I'm not going to assume that same thing's going to move in a straight line and still be happening 6 months later or a year later. My base case is the opposite, that all else being equal, we're going to adapt to that. And what you routinely see in supplement studies is that often the results after 6 months are less good than they were after a month. And so to me, that's the classic, okay, you just saw some degree of adaptation. And so what we at Neurohacker Collective do when we look at studies, we look at individual studies and ingredients with this eye towards, okay, there's going to be a tendency in all likelihood to adapt. Can we start to tease it out in the studies that exist? And when you start to look at things like in that manner, some things that were confusing start to come into, I guess, better clarity.
Yeah,
that would be one of the core principles.
Yeah, and you go about the way that you're developing products and the way that you go about the research is really kind of a collaborative approach, right? I mean, we call it the collective, but there's also like a really collaborative way of looking at this. So you have you in the product development team. This is not a team of pharmacists, or this is you actually have a highly interdisciplinary team developing these products. Can you tell us a little bit about that?
Yeah, so what we have, we actually have a really small internal team, but then we have a lot of what we think of as like subject matter experts. Mm-hmm. You know, so we'll maybe be working on something that would be in the pain category coming up. I know I have a lot of enthusiasm for it, especially something post-exercise. So we already know people that are affiliated with the collective that's their expertise. So when it comes to that project, we'll start to link up with them and share like our thoughts on research, but start to get some feedback from them. And so, you know, what we've been fortunate to do, and I think a lot of this also goes back to Daniel, is he's just really someone that builds deep networks of smart people and has then, you know, convinced them to be, you know, in some way linked in with the collective. And so, you know, we're firm believers in that we is smarter than me. So, you know, so we'll do a lot of the things to make them contributing easy, but we really value those contributions.
Yeah, amazing. This is a very agile approach in how you can come out with different products. And from the world that I'm coming from, is I would expect when you're talking about complex system design and complex system science, I think like, okay, in my mind, it goes like equals big data, equals large numbers. And to my surprise, what I saw on the website is a project that is called N=1 project.
Yeah, so one of the, so what I would have said, like this was, I actually put this in a presentation I did at a symposium, I think around 2007, but the idea of data distribution. So, and I think beta blockers are a really great example of this. So I haven't tried to stay abreast of it, but around 2010, when I last looked at this, the average weight gain for beta blockers was trivial, 1%, 2%, 3%, right? So, you know, and so if you put a patient on a beta blocker and they come back a month, 6 months later and say, hey doc, I gained a bunch of weight. Could it be because of this new med? The tendency will be, well, let me look that up. No, like, you know, that couldn't be because of this medicine. And what I found in one of the studies when I was looking into beta blockers is that you had about 10% of people that had massive weight gain. And then it was that long tail. And when those outliers were taken out of the average doesn't capture those outliers, basically, is what it boils down to, right? So, and my dad would have been one of those people. He was put on beta blockers, gained a lot of weight, eventually had sleep apnea. Not to say that the beta blockers did all of these things and that some degree of it wouldn't have happened, but since there was no acknowledgement that some small subset would have these outlier weight gain events from it, there was no ever consideration to take him off that medication. Yet he would routinely be told by his doctor, like, you know, Dick, you gotta lose weight, you gotta, you know, eat less or do these things, that his system wasn't able to do that between the sleep apnea and the beta blockers and, you know, the job stress and other things. And I think that's where the system comes in, right? So my dad would be an N=1. You know, he seemingly was one of those, like, you know, outliers with beta blockers where he was affected much more negatively in terms of his shape or weight. And the doctor, super well-intentioned, great doctor in the Boston area, gave him advice that frankly just wasn't relevant, right? Like, Richard Kelly, eat less, exercise more. That if it was that easy, then you wouldn't need someone to be telling you to do that. My dad commuted close to 2 hours each way to and from Boston, ran a 5,000 person engineering company, super high performer. But, time to exercise, wasn't on the menu. He would eat whatever my mom, served for dinner. I don't really remember him ever eating breakfast on weekdays because he'd always be in a rush to, get the commute started, right? So when I think of N of 1, it's that system, like my dad being a complex system with all of these different pressures that are squeezing him, and then trying to then work on which of those things can we navigate, and some we can't, right? Like, it wasn't on the menu to not.
Yeah, and I guess in a way that's where a large part of medical research is going right now, to recognize that we're kind of scientific progress is made at the outliers and not so much in the mean. So that's where we recognize individual differences. So some over respond, some under respond, some have, some side effects or adverse events that we're mindful about and that we want to understand better. And rather than brushing it away because it's, doesn't show up in our regular kind of means and standard deviations, where they actually might still be real. And so we're going into the kind of precision or personalized medicine direction, which isn't really yet recognizing complex system thinking. I think it's still kind of, okay, you are that individual that has this molecule transcribed a little bit different, and so therefore you might not benefit from this drug. So it's more like a targeting exercise, kind of who benefits from our single molecule preparation, for example. Whilst you're taking a different approach, you're taking an approach where you recognize that every human being is an adaptive complex system, and how can we do this? So how is, if you like, neurohacker drug development different from, if you like, the let's say the usual small molecule development?
So one, I think from the like one drug, one mechanism approach, and that's an oversimplification, but I don't think that's something that MDs created, right? That's something that the system created. But that's what is needed to get new drugs approved. I've seen a few studies combining, and this was for anti-aging, but in a model organism, like, worms, flies, combining like microdoses of lithium and I think it was rapamycin and then one other medication. And that, like, each on their own had a trivial increase in longevity, but that combination, working on different pathways, made a huge change. Now, that's not to say that would happen in humans, right? Frankly, it's unlikely that it would. But that system approach, being able to work comprehensively on interacting pathways and processes, at least in that experiment, produced much more favorable outcomes. And my belief at this point, and I guess time will tell as science evolves, is that we would see that much more with even approved drugs, that if we could, rather than studying something in isolation, studying how things interact, make much more monumental shifts. But instead, what tends to be the case is, all right, we'll have this like drug for this one thing, let's say beta blockers to decrease heart rate, but then not with, I guess, an understanding that, well, what might that do for someone with sleep apnea, right? Or what about the, that 10% that are, that average number just doesn't mean anything, right? That these are people that seem to, for whatever reason, gain a lot of weight. So that's where that N of 1, this understanding that in biohackers, they say your mileage may vary, that your result may be very different than mine. And one of the other principles that comes out of complexity theory is this idea of history dependence. So anything I was to do today is somewhat going to be, my response will be colored by everything I've done before. Where outside of complexity theory, it's assumed that all of those differences from before can be largely ignored, that they'd be more in the noise category. And in my experience, they aren't. Like to separate me out from my Navy history wouldn't be possible. My response to things now, having eaten pretty well for close to 40 years, exercise for, say 35 of that, anything new introduced into my system has a degree, I think, of resilience because of all these good things I've done for a long period of time, where someone who had lived a completely different life during those years, I wouldn't bank on them responding the same way that I do. They may, but that's where I think this complex systems approach, like thinking in terms of the core principles, gets rid of some of the surprises, or not gets rid of them, but prepares you for when they happen.
It opens our eyes, doesn't it? Yeah. It's interesting that the current trial design, in an attempt to kind of simplify reality so that we can somehow get the idea that we're getting our heads around it, that this oversimplification starting at day 0 of the trial and ending at, I don't know, day 90 of the trial, and we're kind of not looking what happens before and after. So that seems like really a good way to start things off, but it's about time to change that. Yeah.
Yeah, I mean, I don't think that there's that many things in terms of how humans respond that are particularly well suited to a bell curve. So like as an example, we have a product, Qualia Life, that recently we got data back on 9 people that took it for 4 weeks, and we measured NAD and some other metabolites, both after 5 days and after 4 weeks. Now, not placebo-controlled, small sample size, right? So all those caveats aside, but on average, it doubled NAD plus. So pretty cool, right? We were frankly, we'd have been happy with like a 70% increase instead of 100%. But even in that, the average loses a lot of nuance. So I tend to think of super responders. My dad was a super respondent in a negative way to maybe blockers. But so we had, 2 people that their levels went up 4 to 5-fold. We had, a few people that only went up, like 10 to 30%, right? So the average doesn't particularly tell you something meaningfully about how the individual responded. So I even in that 9 people, you see that variance, so I love when you can see how the data displays, because what routinely I expect to see is that you're going to see a subset of super responders, people that literally, whether it's exercise, a supplement, a medication, they get what you hope for and more. Then you get usually a bigger group of good responders, and then, which essentially get the result that you would expect. You typically go get a small group that are non-responders. It just didn't work for them, which is fine, right? I think, because of genetics and all the history dependence and all kinds of things, that's expected. And then I think, you can also get a small group that are penalized, right? That this thing that worked really great for some people was a net negative for you. So one of the things I know we do at Neurohacker Collective is when we look at, say we send a new product we're developing out, to test in 70 people, we expect those 4 bands, essentially, right? And we hope that we do a good enough job designing it so that we get a much higher percentage of super responders than we would have expected based on just kind of like a generic response. And that we, have largely eliminated the negative responders. And then we're prepared to live with, there's going to be some that just didn't benefit, right? Like that's how complex systems work.
Yeah. It's nice. This is very honest. I'm just thinking of wouldn't it be in this kind of N=1 idea, rather than comparing 2 different groups with each other, where you always have this issue of, are they really matched well enough? Are they really similar and comparable enough? And how much of unmeasured bias are we actually looking at? Could you, particularly because you're looking at fairly short acting substances, And if you don't go into kind of 6 months and then you get into adaptation, but if you kind of do short intervention, stop short intervention, it would be really interesting to document the change in system regulation by a trial design that is like a self-controlled case series where every person is its own control. Just you kind of create risk windows and control windows.
Yep.
So it's like a kind of a challenge, de-challenge, re-challenge situation.
Yes. Yeah, that's.
Did you try that?
We're in the early stages of designing a study for our Qualia Night product, which is our like evening nootropic, one that supports calmness in the evening and prepares your body for sleep, and ideally helps our brain work better the next day, because our brain does a lot of cool work while we're asleep to make it show that we're our best heart-based selves that next day. And so one of the things we'll probably do for the pilot study is we'll have people act as their own controls. We'll put them on the product, have a washout, and then maybe have them on a placebo, and then vary who's on the placebo first, who's on the washout first, that type of thing. But yeah, that's a really fair trial design, and one that often can be handled much more like in a more efficient manner than a different style of study. So,
yeah, nice. Well, that sounds really exciting. And you mentioned the word nootropics.
Yeah.
That's what Qualia Mind is like, and Qualia Sleep. And so just help me understand. Just a few years ago, I had no idea what nootropics are until I learned about Neurohacker. And so maybe just could you help some of our audience who are in my position?
Sure. So the best analogy I've heard is the movie Limitless that came out about 8 or 9 years ago. So in that, the main character took this pill that just allowed his brain to work much better, right? He was just a phenom. And so nootropics would be would aspire to that. They're obviously nowhere close, but they're essentially the categories of compounds that help our brain with things like focus, concentration, executive functions, social cognition would be like empathy and those types of things. And some of those are related to the building blocks, like the amino acids that we need to make the compounds that facilitate some of those. Some of them are lipid molecules that our brain is by percent the most lipid of any tissue in the body. So there's all these different substances that our brain, some of them, like I've heard the term brain essential nutrient, in general, things that that can cross the blood-brain barrier that would be found in the diet. Part of the reason is they're brain essential. Our brain has decided these are important enough that I'm going to let them through. And so making sure even we get enough of those in our diet, that helps our brain work better. So to me, nootropics is that category of any of the compounds that can make our heart or our brain work better. And what's interesting is some of those same compounds make our muscles work better, or our heart pump more efficiently, because those three tissues all have in common that they use a ton of energy, much more so than other tissues. So cholines, as an example, there's alpha GPC and acetylcholine are often seen in nootropic stacks or combinations of ingredients, and super important for the brain. But there's been a few studies now on alpha GPC specifically for sports performance. And so again, it goes our muscles and our active tissues tend to have more commonalities than often we think of. So what's funny, even in the supplement world, is you have ergogenics, so compounds for sports performance, and you have nootropics, compounds for our brain. How frequently the same compound could easily be put in both categories.
Yeah,
or something like creatine that's been in, a staple in the ergogenic world since the 90s has now, increasingly being studied for mood and for cognition. So.
How interesting. What an overlap, sort of energy, mitochondrial energy regulation that affects the different systems working together in a fight or flight mode in terms of clicking well and performing well, but at the same time this is not so much about a stress. So nootropics are not stress inducers, but to the contrary, they're actually aiming to increase resilience.
Correct. Yeah. Yeah. A lot of the herbs that end up being in the nootropic category come out of Ayurveda or Chinese medicine or those systems, and tend to be what we think of as adaptogens. So things that help us to, tolerate and respond better to stresses of all types. So, and then, which makes sense, like stress, I guess my simple story is the brain and our heart work as well as the energy available. And energy ends up being, like our discussion of time earlier, a really finite resource. And so things that allow our tissues to do more with that energy, or improve mitochondria and make more energy, tend to do everything from make our focus better, but also empathy. So one of my experience of taking Qualia Mind personally, and again, like your mileage may vary, right? So your experience may be completely different than mine, but about 6 to 7 weeks after I started taking it, I was driving home from work one night. I was about 25 miles from the office is where I was living. So I would routinely be in some degree of traffic on my drive. And it just dawned on me like, traffic doesn't seem to bother me like it used to. And then I started to pay attention, notice like I was essentially just a much kinder version of myself at the end of the day than I remembered being, 2 months ago. So I felt like patience and like what I think of as the social cognition skills, empathy for others, being able to be more in touch with my own social and emotional reactions to things just was more accessible to me. And so while Qualia Mind wasn't designed for that, I think somehow it improved my brain's efficiency and my heart's efficiency. And so like I really felt like a better version of me was showing up both at the office, but usually it's at the end of our day where we've exhausted all our mental energy that the worst version of ourselves shows up. And it's not a testament to our character, it's just we've exhausted that part. And I think for me, something about Qualia Mind seemed to be adding resources into that and allowing a better version of Greg to show up. So it's one of the things that I still love about taking that product.
Fantastic. Well, thanks a lot, Greg, for showing up, for being here, fully wide awake, and
Sure.
and so much with so much compassion and dedication and love, and for what you do. What an amazing journey! Thank you so much for sharing your journey, for sharing your personal learning through to the appreciation of how complex systems work from your own experience to actually now designing products that help create a system regulation that, as you described from your own experience, clearly goes beyond a kind of small molecule enzyme switch somewhere, but actually seems to kind of create an overall sense of health that goes way beyond what might be the indication.
Yeah, absolutely. I think that's like a core part of Neurohacker Collective. Like our goal is to upgrade humans. So we want, like our goal, whether we have the solution or can point people to other people that are developing awesome tools, techniques, technology, we want, everyone to be able to perform better and to be better versions of ourselves.
Wow, beautiful. Next generation industry, next generation pharmaceuticals. Thank you so much.
Oh, my pleasure.
For what you're doing, for doing what you're doing, and for taking the time to be with us today. And I hope we'll see you soon, because we have another topic that we want to explore together, but we won't say what it is right now.
Great. Well, thank you.
Well, thanks a lot.
This has been a Heart-Based Medicine production. Thanks for listening.